Biopsies, not the word of God, so to speak. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focusing cancer care for over 20 years. Recently, there was a patient that I was talking to who went in for a lung biopsy, and the results came back being inconclusive. So meaning they just don't know what's there, which prompting for a repeat biopsy. And so what the general public doesn't know is that these situations are actually not rare. And so different biopsy type procedures have higher incidences of being inconclusive than others. So for example, say a fine needle aspirator biopsy has a higher rate of being inconclusive. Core biopsies where they're taking bigger pieces, it's less. And then excisional biopsies where they say they're removing the entire lymph node, which is the best, or removing the whole tumor, if and whenever possible, is ideal. And what the general public doesn't also know is that, these biopsies, while they're very important for diagnostic purposes, pathology, assessments, and giving ideas of future directions if it's, say, it's cancer. But on the flip side, there is stress on the body. The procedures are a stress. There's risks. It causes like a local inflammation. It could be temporarily immune suppressive. And repeat biopsies, it's not a scenario you want to ideally be in. Which is why whenever trying to do a biopsy is just making sure it's the right one that's possible, and sometimes it's better to wait a little bit to get the better procedure to get done. Also, what I tend to advise personally, it's good to support people for these procedures to try to minimize the stress, to try to minimize the pro-inflammatory response. There's many things you could do here. So one of the things that I really favor is like those intravenous vitamin C, for example, the vitamins before and after biopsies. There's acupuncture, there's like good nutrition, there's nutritional other things you could be doing. But I think it's an area that providing good support could be helpful.